I've had the opportunity to work at many different psychiatric facilities in my career, and I have to say that the Behavioral Health Center is the best one I've ever been employed with. Probably the reason that I love working here so much is the multidisciplinary team and the amount of caring that all members of the team show to the patients, and the amount of change that we're able to see in the different populations of patients.
Nurses here get a very broad experience base as to different types of disorders and the different age groups that mental health issues affect. We are a 60-bed facility. We are a Baker Act receiving facility, and we accept patients from the emergency rooms or from the community. Patients can come here directly. We have 4 different units here. We have an access center, which is really like a psychiatric emergency center, an area where clients can be evaluated to see if they need to be admitted here or not, or to another facility. We have a child and adolescent unit, and then we have 2 adult units, 1 chronic mental health unit, and then 1 that's focused more on DBT skills, treating things like depression, anxiety, and substance abuse.
The kids today are facing many different issues than like when I was growing up. Social media makes it very, very difficult. There is so much bullying in the schools. So we see so many kids who come into our center who are very depressed. Maybe they've had suicide attempts or feeling suicidal, and they need help with learning how to cope with the stress of having a lot of bullying and difficulties both at home and at school.
We see patients come in, you see that they've lost hope, that they're really feeling down, and being able to see the physical and mental improvements that they will experience over the course of a few days is really magnificent, and it's great being a part of that. It's very rewarding.
I think I've had almost a memorable moment every day I've worked here. One that comes to mind was when I was covering on the acute unit for the more severely mentally ill patients, and on Monday this patient was not able to even speak. He was so mentally ill and distraught, and by Wednesday, after being here for just those 2 days, he was able to sing and play guitar in music group. So seeing the change that we're able to accomplish in even a short period of time is so rewarding. So I think anyone coming here would be able to see that very, very quickly.
What I found was a nice, warm environment that supported my ongoing education. I found colleagues that I really cared about and adored, and here now, it's 12 years later, I'm still here, and I don't plan on going anywhere, but it's really rewarding. It has kept me in Tallahassee. It's kept me as a colleague here at Tallahassee Memorial HealthCare.